Would you like us to bring a mic to you
No,
instead?
that's
Sure.
fine, thank you.
Thank you, Kevin. As usual, you're an excellent moderator. We appreciate it. And thank you to the Health Alliance for providing us with these forums. And Cynthia, I'm going to shock you by agreeing with you that we have probably the best primary care physicians. And I have been fortunate enough to have one, Dr. Aaron Dietrich, who's the best I've encountered anywhere in this country.
Good to
So,
know.
on that, we can agree. Now, the
Well,
health.
mic up,
Sure. The Health Alliance was formed to effectively integrate affiliated healthcare organizations and services across the continuum of patient care and thereby serve the present and future needs of all people in the region. Health Alliance was given $47 million in state funding, $150 million in tax-exempt bonds, $181 million from the federal government, unknown income from both hospitals, all taxpayers' monies. Therefore, it is the right of the taxpayers to be given a full accounting of these monies, a disclosure of the rationale for the acquisition of Woodland Ponds, while Golden Hill Nursing Home needs were ignored, and any relationship of the Health Alliance board members and its administration to Woodland Ponds, which might explain the acquisition of this failed venture. Also, the full cost of renovations and new buildings and the deficits they have incurred. The amount of money which the Benedictine order will gain from the buyout, and if the Benedictine deeds prevent a transfer, what are the Health Alliance options? The future costs of proposed renovations to Benedictine Hospital. What monies will be put into escrow for future community investment if and when the new hospital fails? The Health Alliance was entrusted by the public, and now they need to fully report to the public the expenditures and basis for the failed planning model. When can we expect such a report?
You're gonna leave me with it?
Yeah.
Okay, the question I said I wasn't gonna answer in the beginning, I guess you're gonna have a chance to answer it now, Dave. The government money that you've received, Paul outlines 47 million in state funding. That's a pretty quick question. 150 million in tax exempt bonds. And by the way, Cynthia, really good ploy when you're talking about choosing this campus, to have the helicopter land on the pad while you were answering the question. It's taking off again, so we might have a little interruption. 181 million from the federal government, unknown income from both hospitals, all taxpayer money. We'd like a full accounting of these funds.
Let me start by addressing the 47 million. It was established to assist in the transition, as Cynthia described, from the Burger Commission. It was necessary in order to distribute the services and to balance. A mandate of the Burger Commission was to keep both hospitals open. And so in doing that, the bed distribution was 150 at each. Included in that was the distribution intent to have more emergent care at the Kingston facility with the emergency facility and more specialized elective care at Benedictine. So it required modifications in order to make that happen. And there were HEAL funds made available to assist throughout the state with ventures such as this. We were the third largest. We were not the largest, but we were the only one that I have been advised that kept both facilities open in this venture. So we were viewed by the Department of Health as the poster child of the Burger Commission in that venture. That being said, the expenditure of that 47 million, approximately half went to debt reduction for both hospitals. That was distributed. And then also for the physical improvements that were needed. There were 15 different capital projects split between the two hospitals to prepare the hospitals to receive the care as we define according to that distribution philosophy. So None of it was used for operations. It was intended to prepare the facilities to accomplish what was intended by the separation of or the balancing of the two under a single parent. So the $47 million was distributed based on a plan that was developed and approved by the state to accomplish what was intended by both of the hospitals.
Tax exempt bonds, he talks about a number, 181 million,
I
I'm
don't
sorry,
know what that refers to.
150 million in tax exempt bonds.
I don't know what he's referring to there. I don't
I'm
know.
not
And I
either.
don't know that 181 in federal money, if that's from Medicare and Medicaid, that's reimbursement for services rendered.
Next.
That I believe the 180 would have to be Medicare reimbursement for services provided. And I will say that Medicare reimbursement is highly discounted. So even though it just reflects the level and the quantity of services provided by the two hospitals.
Well, then ask some questions regarding Woodland Pond. A disclosure of the rationale for the acquisition of Woodland Pond and any relationship of the Health Alliance board members and its administration to Woodland Pond. Is there a,
Is that a question regarding conflict of interest? Is that how you understand it?
I think he just wants to know if the Health Alliance board members have any affiliation with Woodland Pond.
Well, Woodland Pond is an affiliated organization, so there are separate boards. But, for example, I attend those board meetings because we're concerned and it's an affiliate. If the question is regarding whether or not there are conflicts of interest in the construction of Woodland Pond, I think that people should understand that we have a very robust compliance area in the hospital, and we are constantly reviewing all of our board members for conflicts of interest, and we're not aware of any that exist relative to Woodland Pond or any of our entities.
The other half of the question regarded the rationale for acquiring Woodland Pond. If I'm not mistaken, it was originally part of the Kingston Hospital entity, wasn't it?
It goes back many years, and it started as in a period of time when it was viewed that perhaps the way to succeed in healthcare was to diversify, and obviously the people who would be buying at Woodland Pond would provide a stream of patients to the hospital. I think it should be understood that Woodland Pond is a continuing care retirement community. People buy their units there and live there. It's not the same as a nursing home and can't be completely compared to Golden Hill. There's a lot of differences.
Also, Golden Hill is not affiliated with the Health Alliance.
No, there's no, but that was mentioned in the speaker's comments.
The next question concerns how much money the Benedictine Order will receive if Health Alliance acquires the campus.
I believe that's part of the discussions that are currently underway.
Okay. The cost of renovations that were just undertaken. You outlined some of it when you were discussing the $47 million. Were there other renovations that were not part of that $47 million? And the second part of that question is, did they contribute to the deficit that you're experiencing?
We have continued, every hospital is always looking at ways to adjust to the changing medical environment, improving services with updated technology and methods of care. So that's an ongoing commitment. If you look at most hospitals, you'll find that they're constantly renovating and updating. So that's not unusual at all. We have completed several projects that since and outside the HEAL funds in order to invest in, for instance, our breast care center. We've seen tremendous growth in that area. We've seen improvements in imaging centers with upgrading technology. Technology is something that is continually improving, and it's important that we stay current with that in order to provide the care that's needed. So these are ongoing improvements that are very typical of any hospital if they're staying current and providing the services that are needed.
But I think we should also note that many of the improvements are funded through our foundations, and we have very generous donors both through the Kingston Hospital and the Benedictine Hospital, and they generously provided funds to do a lot of the improvements.
So the second part of that was, has it contributed to the deficit situation that the hospitals are facing?
It's all part of the operations that provide the services. So each of the projects, we intend for it to build and improve services. So it's all part of the package of services that we provide.
Paul, I would ask that maybe afterwards we can do a little side meeting and we'll try to discuss some of the other federal money that the panel doesn't seem to be clear on what you're asking about, but we'll be happy to try to get to the bottom of that. The next speaker is my former colleague on the county legislature, Attilio Contini.